this video, we want to talk about the human immunodeficiency virus, which is known as HIV. The HIV virus damage what we call CD4 plus T cells. These are a type of the white blood cells in the immune system. So when these cells are damaged, it causes failure of the immune system. So what happens when your immune system is damaged? The ordinary disease which your body can easily deal with that on the normal situation can make you ill, so that the body falls prey to life-threatening opportunistic infections such as pneumonia and forms of cancer. When a person got the HIV and its immune system damaged and it got some serious infections like the pneumonia and some form of the cancer, this situation is called the AIDS. So it stands for acquired immune deficiency syndrome. AIDS is a situation when a person was HIV positive and the virus has damaged its immune system, and now he got some serious infections. So in this situation, because its immune system is damaged, it cannot fight that secondary infections. This situation is called the AIDS. Okay, to understand how the HIV works, you must know the life cycle of HIV when it infects the T blood cells. Okay, this picture which you have in your book, it shows the life cycle of the HIV. The human immunodeficiency virus is retrovirus. Okay, so retroviruses are the viruses which they have RNA, not the DNA. Okay, so now let's go to this picture and see what happens during the life cycle of the virus. So in the first step, the virus must penetrate into the cell. This happens by attaching to the receptors which you have on the surface of the CD4 T cells. When the virus attached to this one, it can penetrate through the cell. The virus carries an enzyme which we call it reverse transcriptase for making DNA from its RNA. Okay, so here the virus contains these enzymes and it brings it into the cell with itself. So these enzymes makes the DNA. So this is the second part of the life cycle of the virus. After the DNA of the virus has made, it penetrate or incorporated into DNA of the host cell. Okay, so this is the third stage in the life cycle of this virus. And then when the host cells wants to replicate its DNA, it also replicates the DNA of the virus with itself. Okay, so during this process, a lot of virus is made inside the cell, and finally they go out from the cell and they take some part of the cell with themselves. Okay, as the envelope of the virus. So the last step is releasing the virus from the cell, and these viruses can go and they can damage the other CD4 plus T cells. For treating the HIV, we have some drugs which we call them antiretroviral drugs or ARVs. Okay, so how these antiretroviral medicines work? So they can act in the 4 stages. The first one, some of these ARVs or antiretroviral medicines, it blocks here, so it prevents attaching the virus to the surface of the cell. The second type of the ARVs, they are reverse transcriptase inhibitor. Okay, so what they do, they don't let the virus to make the DNA from its RNA, so it blocks this system. The third type of the ARVs, they prevent DNA of the virus from incorporating into the DNA of the host cell. And the last type of these antiretroviral retroviral medicines prevents the virus from escaping the cell in the last stage. So the virus has made inside that cell, but they cannot go out from the cell and damage other T cells. On the next page, these four mechanisms of the ARVs or antiretroviral drugs are mentioned here. So you must know how they act on the virus and how they can prevent the virus from spreading. So you must know that these drugs, they don't cure the patient, but what they do, they can give lasting suppression of the HIV infection. So they suppress the HIV infection, so it changed the HIV infection from fatal disease to chronic disease. So it means it controls the disease, but it cannot completely overcome the HIV. But why treating the HIV is very difficult? On the previous page at the bottom, three reasons are given that shows you why defeating the HIV is more challenging than the other viruses. The first is that this virus destroys the T cells. Okay, so it's destroying your immune system, the system which is responsible for fighting the infections, for fighting the viruses, for fighting the bacteria. So if they are targeted themselves, they cannot work properly anymore. The second reason is that the virus, HIV virus, mutate very rapidly, even inside the body of the patient. So you can have a patient that is infected with one type of the HIV, but through the course of the illness, when you check the patients, you can see that there are several types of the HIV inside her body and her cells. Okay, so even the mutation of the HIV virus is more than mutation of the influenza virus. The third reason is that sometimes the virus lies dormant. It means it's inactive, especially when its concentration is low. So it's inside your T cells, it's damaging the cells, but because it's dormant, your immune system doesn't respond to that one. So when it doesn't respond, it can multiply themselves and suddenly their population increases, which makes the HIV positive patients. Okay, among these type of the antiretroviral drugs, reverse transcriptase inhibitors are the most common. The famous one is called AZT or zidovudine. Zidovudine is reverse transcription inhibitor. But for the treating the HIV, usually the mixture of these ARVs are given. But they are typically include two different reverse transcriptase inhibitor and one of the other type of the ARVs drug. Okay, but the cost is very expensive. Annually, the patients must take around $12,000 of the medicines. And the pandemic of the HIV was in the poor African countries, so that's why it was very difficult to prevent the expansion of the HIV. The research is going on for the making the vaccine for the HIV or finally the AIDS. The vaccines that they want to make is therapeutic vaccine. It's different from preventative vaccines that we had and we explained about that one earlier. Therapeutic vaccine is given to the patients which is HIV positive. It's very difficult to make preventative vaccine. That's because of the nature of the HIV. As we said, it's mutate very fast, so you have variable nature of this virus within even one cells, so it's very difficult to make preventative vaccine for that. Another problem is that the immune response seems to act too slowly in the case of the HIV infection.